Hi, my name's Megan. I'm going to be your student physical therapist today. Can I have your name and date of birth?
Yeah, it's Sally Sue, and then my date of birth is January 11th, 1991.
All right. Did you happen to sign the informed consent when you came in?
Yeah.
Did you have any questions about it?
No, I don't think so.
Okay, perfect. All right. So what brought you in today?
So I was in a car accident like 6 months ago, and I was hit from this side, so my whole left side of my body got jammed into my driver's side like window, and that like caused a lot of pain in my shoulder, and I actually ended up going to the ER, and they treated me for concussion, but they didn't know what was going on with my shoulder. They didn't say there was like a fracture or anything, so they pretty much just told me to do like RICE therapy. I think that's what it's called, like the rest, ice and elevation,
Yep.
compression.
Yep.
Okay.
You're correct.
So then it got a little bit better, like the pain and everything for my shoulder, but then after that, it got like progressively worse, and that's when I decided to see my doctor about 2 weeks ago.
All right. Can you give me the name of the doctor that referred you?
Yeah, it's Dr. Smith.
All right. And did he perform any test or give you a diagnosis?
He gave me an X-ray, but he actually just called me a few days ago and said that the X-ray was there weren't any signs of fracture.
Okay, no fracture.
Yeah.
All right. So you said the pain was in your left shoulder.
Yeah.
Can you describe to me where that's at?
Yeah, it's just kind of like all over, like not really like a distinct spot.
Okay. Can you describe the pain?
Yeah, I'd say it's like achy. Just doesn't really go away.
Okay. Do you notice that pain radiating down your arm at all?
No.
No numbness and tingling down your arm or fingers?
No.
All right. Do you have any instability with any motions in that left arm?
I have a lot of instability, especially like when I'm lifting up and like overhead, and that's about all.
Do you notice any popping or clicking when you're lifting up overhead?
No.
And you said that you had bruising and swelling on the onset, but since then, have you noticed any?
No, I haven't noticed any since then. Just right after my accident.
All right, perfect. All right. Do you notice any stiffness in that left shoulder?
In the morning I do, but then it usually goes away once I start moving around.
And right now, what is your pain? 0 being no pain and 10 being ER pain.
I'd probably say like a 3 out of 10, just like resting here.
And what has the least it's ever been?
Probably that 3 out of 10.
3 out of 10.
It doesn't get better than that.
Okay. And the worst?
Initially at the accident, I would probably say like an 8 out of 10.
8 out of 10.
Hurt bad.
All right. All right. So I'm going to kind of give you a summary, and I want you to know if there's anything that I'm missing.
Okay.
So you were in a car crash 6 months ago. You hit your left shoulder on the driver's side door. You went to the ER, and they diagnosed you with a concussion, which is now treated, correct?
Yes.
Okay. And they told you to rest, ice, compress, and elevate your shoulder. The pain progressively got worse. So 2 weeks ago, you saw Dr. Smith, who gave you an x-ray and said no fractures. So he referred you here. That pain in the left shoulder is all over, not really in one particular spot.
Yeah.
It's achy, and it doesn't really go away.
Mm-hmm.
Right now, your pain is at a 3 out of 10. The best that it gets is also a 3 out of 10, and the worst has been an 8 out of 10. You don't notice any numbness or tingling down your arm, no popping or clicking in your shoulder, no swelling or bruising right now. And you do notice that it's stiff in the mornings, but that goes away as you start to move your arm.
Mm-hmm.
And you have instability lifting overhead.
Yeah.
And
pain.
And pain, okay. Does that all sound correct?
Yeah.
All right, perfect. All right, so going off these motions, is there anything that you do at home that limits you, that you can't do anymore?
Yeah, like my kids are actually like on the top bunk of
Okay.
like that's where they sleep, so I have to like lift them up to that top bunk, so that really is very painful, and I just feel like my shoulders gonna pop out.
All right.
Also, like the same motion when I'm like putting groceries away and trying to put them on the top shelf, or even buying them at the grocery store when they're on the top shelf. When I'm getting dressed in the morning, I guess like when I'm doing that like reaching motion to like tuck in my shirt or something like that.
So reaching across your body
Yeah.
also gives you pain. And
Yeah.
do you get that same feeling of instability when you reach across your body?
Yeah.
Okay.
Yeah.
All right. And so you have kids. How many kids do you have?
I have 3 kids.
3 kids?
Yeah.
All right. And are you married?
Yeah, I have a husband.
Okay. Is he able to help you out around the house with the activities that you're having problems with?
He travels during the week, so
Okay.
pretty much the chores are left up to me and like taking care of the kids and everything. But on the weekend, he can help out.
Okay. And do you work?
I'm actually a stay-at-home mom. So
Okay.
I used to be a nurse, actually.
Oh, cool. All right. And does this pain wake you up at night, or do you have any problems sleeping?
Really only when I roll over on my left side, that's when it's irritating. But for the most part, I get a good night's sleep.
Okay. All right. And so was there any hobbies or anything that you enjoyed doing before the accident that you can't do anymore?
I love, like, I lead a pretty active lifestyle, so I love to, like, jazzercise and swim at the rec center, like, 2 to 3 times a week, and just take care of my kids, you know.
Yeah. All right. So as far as like goals in therapy, are those some of them or?
Yeah, definitely. I'd like to get back to those.
Okay. So those would be your goals.
Mm-hmm.
All right. And as far as the pain, do you do anything to alleviate that?
Usually I just use that rice therapy,
Mhm.
you know, just icing it.
Okay.
And trying to avoid some of those aggravating activities.
Do you take any medications for the pain?
I take ibuprofen,
All right.
just as needed.
Do you have any history or do you smoke or drink?
I have a glass of wine every, 2 to 3 times a week
Mhm.
or whatnot, but that's about all. I don't use tobacco.
Okay. All right. All right. So we're going to go ahead. I'm going to ask you a few questions about your past medical history.
Okay.
Does your parents have any family histories, any heart problems or diabetes or anything?
Mm-mm.
Nothing that you can think of. Do you have any history of any neurological problems, skin problems, respiratory? Do you have a history of seizures?
No.
Do you have allergies?
I do have seasonal allergies.
Seasonal?
Yeah.
Okay. Do you have any implants?
No.
Are you pregnant or do you plan to become pregnant?
No.
You did say you take ibuprofen. Other than that, do you take any other medications?
I take Claritin for those allergies I just mentioned, but
Okay.
I take like a multivitamin. I don't know if that counts as a medication.
Okay. Let's see. Other than before this accident, how would you describe your general health?
I'd say it was really good. Now I really didn't have any limitations in
Okay. No
anything,
limitations.
and now it's just the stupid shoulder.
Yeah. All right. So, did you happen to have any musculoskeletal history?
Yeah, I used to swim in college, and
Okay.
so I think it was like 2008. I dislocated my shoulder.
All right. Do you know in what direction that dislocation?
Like forward.
Forward?
Yeah.
Okay. Perfect. Forward. And did you have any treatment with that?
I went to PT for that. Yeah.
You did. And how was your experience with that?
Great. I was able to get back to everything.
All right. So you were
They did
able
a
to be
great job.
full functioning after
Mhm.
that?
Yeah.
Awesome. And so you've had anterior dislocation in the left shoulder. Which arm is your dominant arm?
My right
It
hand.
is your right.
Yeah.
Okay. All right. Perfect. All right. And before we go ahead and get started, I'm going to ask 2 questions that we ask everyone.
Okay.
During the past month, have you felt down, depressed, or hopeless?
No.
And during the past month, have you often been bothered by little things or pleasure in doing things?
No.
Awesome. All right, Sally, let's go ahead and get started.
Okay, great.